Participants should mute their microphones unless they're invited to speak. Cameras should be switched on where possible, and obviously if you've got some IT issues, we'll understand that you need to have the camera off. All those wishing to speak should use the hand up function, please. Mobile phones should be switched to silent. Participants should refrain from using the chat messenger function to conduct conversations if you can. That would be great. A reminder that the public section of the meeting will be recorded and later made available on the website for public viewing. And in the event that there's a break in the meeting, the recording will be paused. So I think we can now start the recording.
I can confirm that started.
Thank you. And Fiona, will you mind taking a roll call, please?
Thank you, Chair. I'll just cover the initial statement of GDPR first, if that's okay.
Okay.
Just welcome everyone to the meeting today on the 24th of June, which is being held remotely in accordance with the Scottish Government's recommendations as regards physical distancing during the COVID-19 outbreak. This meeting is being recorded and will be made available as a webcast in order to allow the public access to the democratic process in East Lothian. NHS Lothian is the data controller under the Data Protection Act 2018. Data collected as part of the recording will be retained in accordance with the Health Board's policies on record retention, and the webcast of this meeting will be publicly available for up to 6 months. And I'll now turn to the roll call of attendees. So when you hear your name, you'd respond, please. Shameen Akhtar.
Present.
Neil Gilbert. Sue Kempson.
Present.
Fiona O'Donnell.
Present.
Thank you. Patricia Donald.
Present.
Fiona Ireland.
She's put apologies in, Fiona.
Has she? Thank you. Peter Murray.
Present.
Richard Williams.
Present.
David Binney.
Present.
Philip Conaglan. Lorraine Cowan.
Present.
Thank you. Richard Fairclough. Claire Flanagan.
Present.
Ian Gorman.
Apologies.
Oh, thank you. Alison MacDonald.
Present.
Marilyn McNeil. Thomas Miller.
Apologies, he's on leave.
Oh, it's me. Thank you. Emma Rainish. Judith Tate. John Turville. Leslie White. And Paul White. I think Paul was here. I did see
Sorry, present.
Thank you, Paul. And I can confirm that's, I have apologies now, Fiona Ireland, Ian Gorman and Thomas Miller. There are no other apologies recorded. Can I ask if any members have any declarations of interest to make?
No.
No, thank you.
Fiona, there's apologies from John Turville, who's on leave.
John Turville as well, thanks.
And can I also give apologies from Judith Tate? She's on leave.
Okay, thank you. I'll record those in the minute. That's all the preliminaries done, Chair. We're ready to start the business.
Okay, I can see a hand up. I can't make out who it is.
I think that was Trish. Oh, she's put her hand down now.
All right. Okay, thank you. Okay, so the first item on the agenda is the minutes of the IJB meetings of the 25th of February and 22nd of April for our approval. First of all, can we go through them for accuracy? And I'll just take it, unless somebody indicates that they are discontent with the accuracy of the minute, that will take both as accurate. I'm not seeing any indication of any discontent, so if we can go back to them for matters arising, and we will go through them separately this time. So 25th of February, page 1, 2, 3, 4, 5, 6, 7, and 8. So no indications there. And now on to the 22nd of April. Again, page 1. 10 is in your pack. And 11. Nope, so we're happy with those, accurate and no matters arising. Thank you very much. That takes us on to item 3, which is the Chair's report. This will be very brief. I have received a letter today from, or this week, from NHS Lothian Chair of the Board, requesting responses to a number of issues related to our delegated functions. I have shared that letter with Alison, and we will be providing a response to it. It's an interesting shift in approach to how we might have previously expected that relationship to take place, but nonetheless, it does invite Alison to consider a few issues that I'm going to ask Alison just to comment on in a moment, because I think it's helpful, Alison, if you just say 1 or 2 things in relation to what you've been asked, and we will share the response with the membership as and when we are in a position to do that. Alison, do you want to add anything to the generality of what I've said? You're on mute, Alison. You're on mute.
Just as well, because I was frantically looking for the letter. Do you want me to comment in general, or do you want me to comment on the letter, Peter?
Just in the letter, yeah.
Yeah, I think, as Peter says, it's a different approach, and we have been asked to look at what services we would be looking to commission from NHS Lothian moving forward, in quite a formal way. We've been asked about the inpatient beds at the mental health units, how many we feel that we'd be wanting to commission, the treatment of people with learning disabilities, and what inpatient services we would be looking to commission. And I'm sure members of the board will remember that over the last year or so, we've had a couple of papers here. Gillian and previously Rona Laskowski had brought papers to agree bed numbers for the project teams for the Royal Edinburgh. So that's been within the IJB's radar. It's been for a couple of years. So that's not a significant issue. But what we will need to do is just revisit it. I don't think ours have changed, but I think we will bring back to the IJB just for confirmation of that. We're also in a bit of discussion with NHS Lothian at the moment about psychological therapies, and we will continue that conversation. So they're asking what psychological therapy services we would like to see delivered. They're also asking about our commissioning of services in the community for people with mental health issues and with learning disabilities. So, I mean, these are all things that we do anyway. So I think what we'll be able to do is quite easily bring that together through the strategic planning group and some of the change boards. So I see some of this work or the answers sitting with work that's already happening in East Lothian and the change board. So we're being asked about that. I think the other things that we may find a bit more challenging will be the number of acute beds that we require in places like the Royal Infirmary and moving forward. We've got a paper later on today about the start of the provision of care homes and community hospitals. So some of the work we've done in that gives us a bit of an insight into the activity in East Lothian and who's going where and how often. So that may give us a start to inform some of that work. But again, that and the other elements that are, there's 11 points, they're all different services. I see the work for answering this very much sitting in the strategic planning group and the change boards. But I think a lot of the work that we're currently doing will enable us to answer that, because they're services we deliver anyway. It's just maybe the way it's framed. We'll need to make sure that we've covered all the elements. But a different approach. We haven't been asked like this before.
Alison, sorry, can you just remind me of the deadline? Is there a deadline?
There is the end of August. So,
Right.
but what we have said as chief officers is that's a very tight deadline for such a detailed piece of work, and also it's work that we would bring back to the IJB before it was going to be returned. So what we're saying is that we will go back by the end of August with a plan as to how we will deliver this information by the end of August. So we haven't committed to getting the actual work done by the end of August because it's quite a lot of work to pull that together in such a short time frame.
Yeah, thanks, Alison. Fiona, you want to come in?
Yes, I just wanted to ask Peter, does the joint forum, does that exist in any way just now where all the different IJBs, chief execs, chief officers come together?
Yeah, the Planning and Development Committee.
Right. And was this discussed there?
No.
Right.
No. It's I think I became aware of it from another source at the point where I received it almost the day before. But it's a shift in approach that may in some respects be surprising, but also it could be, depending how the strategic planning group determine the most appropriate response, it could be in our interests, because there's quite a lot of delegated functions that we've not really been able to capture or create expectations on the acute. So if that work is possible, and obviously Alison's more in touch with that than I am, the detail that's going to be required to get that information, then it does place a contractual kind of element to that through a direction that I think we'd have to consider adding to our already established directions. That would be my take on it. I don't know if that's your view on it, Alison.
Yeah, I do think it is, and I think some of the work that that's currently ongoing about the review of unscheduled care plays into it as well. So I think it maybe gives us an opportunity to state our case for what East Lothian expects and what we need. So I think it's a bit of work, but I think we should see it as an opportunity to state our case about what we need and what our aspirations are.
Yeah, thanks, Alison. Paul, so I should have asked, have you seen the letter? Because if you haven't, I'll send it to you.
It's been copied to me by Alison. Yes, I've not been able to scrutinise it, but I do have it, and I'll be working with colleagues and Alison to take whatever action we need to on the back of it. Can I just say, Peter, while I've got the opportunity, Fiona Curry's had to step out because there's a fire alarm in her office, so we're temporarily without our admin support, our clerk.
Should we just pause for a couple of minutes? Is it normal for it to be over quite quickly on the assumption it's not a fire?
No, it takes a while.
This isn't the normal time. But this isn't the normal time for if it's in John Muir House. It isn't the usual time.
Okay. So are we in a position to carry on, Alison, without Fiona?
I think we can. We're recording, so she'll be able for the minute to fill in any gaps.
Yeah, good point, Fiona. Thank you.
Chair, sorry to interrupt. My raise hand function doesn't seem to be working for some reason. How would you like me to?
Just put your hand up, Richard, if you can. I'll try and spot you. Yeah, I've got you.
It's okay to speak.
Yeah, fire away.
Thanks, Chair. I'm just wondering about what will have triggered this change of approach. Do you have any kind of thoughts around that? And it just strikes me that is this not what our directions would be setting out? So is this kind of short-circuiting the formal direction process, or does it complement it?
I think there's lots of potential responses to your question, Richard. The one that I would be prepared to offer you at the moment would be that it may fit within the integration scheme work. So it could well be complementary to that. As the integration schemes are being reviewed, that might make sense for them to capture more explicitly what the relationship and expectations are.
Thank you.
Alison, do you want to add anything to that, or are you happy with that as a response?
I'm happy with that. I suppose the other element is the independent review of adult social care, the Feely report. And I think there's lots of people around just trying to work out where the balance may lie moving forward.
Yeah. Okay, thanks for the question, Richard. Have I missed anybody else? who's in a similar position to Richard, just speak up if I have.
Yeah, Peter, it was just to ask, kind of Richard and Alison kind of maybe touched upon it, but did they give any rationale behind it? Because it's quite a short time scale because we're in July, next week already. And I just wondered if there was any, with NHS Lothian coming out of special measures for scheduled and unscheduled care, would that have any kind of reasoning behind this at all?
I'm not aware of it.
Shimeen, if it's okay for me to come in, Peter?
Yeah, of course.
Yeah, I think it's, you'll recall that at the strategic planning group, I think it was Rebecca Miller from NHS Lothian came to talk to us about Lothian strategic development framework, and that's what the letter is entitled. So
okay.
It seems that it's caught up with the development of the strategic framework.
Okay, thank you.
Any more before we move on? That was all I was going to say by way of Chair's report. Nope. Okay. I'm not sure if Fiona's back. I'm sure she'll speak if she is. We'll take it that she's not, so we'll carry on. Items 4 and 5 obviously come together in some respects because, as most of you will know, they have both been the subject of quite a considerable amount of work in a development session or development sessions. So whilst we are required to have a roll call on both of these, I'm going to make a broad assumption that the paper won't need much of an introduction, or papers won't need much of an introduction, because they have, as I said, been the subject of quite considerable discussion already. So I'm going to hand over to Alison, unless you direct me somewhere else. Alison, is it Christine?
No, I think it'll be Gillian Neal to start us off, and then Christine to follow up. Thank you.
Okay.
So, Gillian, hand over to you.
Thanks very much. Good afternoon. So as the chair has highlighted, we have had considerable discussion around the community transformation programme, and at the IJB development session, which was held just at the latter part of May, we provided an overview on our engagement and update on the work that we've completed since the latter part of 2018, in order to provide the IJB with the opportunity to discuss and consider the options for delivery of the recommendations and model as supported and agreed by our reference and engagement group, and also the opportunity to consider the wider financial and policy implications, which are detailed in Appendix 1 of the papers that are in your pack. So the purpose of the paper being presented to you this afternoon is really to inform the IJBs of the proposed principles and strategy that we require to deliver the recommendations of the Community Transformation Programme. And I'm just going to discuss this very briefly in relation to adults under 65 with complex needs, which is across learning disability, physical disability, mental health and sensory impairment. And then I'll hand over to Christine Johnston, who will present older people. And I just really need to make it clear that the IJB is being asked to only consider and agree to the proposed principles and strategy that we are required, which is set out in 3.2 and 3.3 within your attached papers, with the recommendation that we return to the IJB in September with an update on our position, where we've got to with some of our proposals, and agreement with the IJB around the next steps. And just before I go into just summarising the key principles, it's really just a reminder for the IJB and those that maybe weren't present at the development session, that the proposed key principles that really are underpinning the future of day services across both older people and under 65 are very much based on the extensive engagement that we've conducted with service users, carers, parents, providers and other stakeholders, which have very much been supported and guided by our reference and engagement group. And really just as a reminder, some of the themes that emerged from our engagement were very much around maintaining friendships, increased choice and flexibility, a reduction on dependency on services so that we are really helping people to develop and enhance life skills and independence. People are looking for evening and weekend opportunities, meaningful activity, improved support for carers, improved transport, and most importantly, services that are embedded within people's local communities. So if I can make reference to the proposed key principles as set out in 3.2, what we're looking for the IJB to is agree that our key principles for underpinning our future day services, which would be effective from April 2022, are very much focused around delivering local services that are commissioned and that are based on individual needs and assessed outcomes, where we're shifting the balance of service delivery to the community and making the best use of the potential of self-directed support, which provides people with that choice and flexibility. The principles are around reduction in carer stress. We need to provide services that are based locally within East Lothian unless there's a clear rationale for using out of area services. As we've highlighted in the recommendations, we need to deliver building-based services for those that have the most complex needs, and they will need to be established by agreed criteria. And as we discussed at the development session, we are clear about the effective governance arrangements that we need to put in place for both internal and externally provided services, which really are based on genuine partnerships with third sector, social enterprise and local communities, which provide high quality, innovative day opportunities, making the best use of our community assets. And the second point that we are asking the IJB to agree is the strategy that we are required to deliver the service model, and it's really based on two linked phases, which again are described in 3.3.1 around an asset review. So that's very much bringing forward our proposals to reinvest in high cost service arrangements from April 2022, which is allowing us to sort of recycle investment in community-based approaches. And we're already under a number of discussions already with, for instance, our transport services within East Lothian Council. And again, it's about completing an option appraisal around the future of our building-based services for adults with complex needs under 65. And again, an option appraisal has to be dependent on full engagement from our service users, carers, providers, and our East Lothian health and social care staff, because obviously internal services are a big part of that work, so that we can look at what options we have and recommendations, which would include an integrated impact assessment, and we would report back to the IJB with our findings and recommendations for discussion. And the last part of this phase around our strategy would be to carry out an evaluation of our pilot resource coordinators who are already in place and taking forward pilot pieces of work. So again, to report to the IJB on the finalised service design going forward and the costs associated with this. It's about our engagement with East Lothian Works and local employability programmes to support models for young adults with complex needs, and again finalise the service model going forward and associated costs. Alongside that, again, it's the design around how we provide mental health support and employability within the community. And lastly, the recommendation around the purchase and implementation of a digital travel app, which will support independent and supported travel again feeding into some of the themes where people want to be more independent and less reliant on the use of some of our transport.
So you, Gillian?
Yep.
Yeah. Thank you very much for that. I'm getting some feedback. Has everybody got a mic off? Yeah, thank you. What I propose to do, Gillian, is take questions on this paper. I know there are some similarities with the next paper, and you've alluded to that, but rather than get confused between the two, because there are differences, I'm just going to pause and accept that there may be a degree of overlap between this and the next one on the principles, but the content and the questions may differ. So if everybody's happy to focus their questions on primarily the principles and the strategy that the report is asking us to consider and accept. So, Patricia, I think your hand was first.
Thank you. I just wondered if you probably have covered this, but just how much the third sector are involved in being a sort of collaborator and support with the implementation of your strategy.
No, thank you, and that's a very relevant question. So at the development session, and again within Appendix 1, we did provide an overview of the engagement that we've had with all stakeholders since the transformation programme commenced at the latter part of 2018. So they are very much part of the reference and the engagement group. And again, we've had very specific engagement and consultation events with providers and the third sector, and will continue to do so because it's very important. But they're very much round the table with us and are supporting us to make the links with voluntary organisations and take it forward, but very much at the forefront of our project and our engagement.
Thanks, Gillian. Thanks, Patricia. Any other questions or comments on Gillian's paper? I'm not seeing any. If Richard, if your hand is not up and you want to speak, just shout. Okay, I'm not wanting to rush everybody, but on the basis that everybody seems reasonably content to go to recommendations, is Fiona back?
Yes.
Yeah.
Apologies for that.
Fiona, can I hand over to you then to do the roll call for this?
Certainly. Can you just confirm, is this item 4?
4.
Item 4, thank you. And the recommendation is to agree the principles set out in 3.2 and to agree the strategy is set out in 3.3, and to note the proposals will be brought to the IJB in September. And I'll go through the voting members individually, and if you could indicate which way you would like to vote, please. Shimeen Akhtar.
Support.
Neil Gilbert.
Support.
Sue Kempson.
Support.
Fiona O'Donnell.
Support.
Patricia Donald.
Support.
Peter Murray.
Support.
And Richard Williams.
Support.
Thank you. I can confirm that the recommendations have been approved unanimously, Chair.
Thank you, Fiona. Fiona, do you need a minute to get back, or are you back with us now?
No, I'm okay to continue.
Okay. So we're ready to go on to item 5.
Item 5 is the Community Transformation Programme Adults with Complex Needs over 65.
Thank you. And Christine, I believe it's yourself.
Yes, thank you. It was really valuable at the development session to have a chance to go over the background, the proposed model, and some of the challenges in terms of policy and finance. So that was a welcome opportunity. So for today's meeting, really just looking to confirm the principles that have been set out in section 3.3 of this report. And as you've indicated, Chair, a lot of it dovetails with the work of the under 65s. So the first principle that we've set out is that we want to commission services to deliver local services that reflect the varying needs of local communities. So what we've experienced in the consultation and engagement that we've done with the centres and with the carers involved in those centres is that actually the local need varies hugely, and we need to move away from a sort of one-size-fits-all model. The second principle is about flexibility of provisions. So we've seen, because of the COVID pandemic, that centres had to close for a while. Luckily, we've managed to get some of them open, but they're very restricted in terms of what they can do in terms of infection control. So we want to look at having a flexible model, keeping the centres. Absolutely, we need the centre bases, but we want to invest and develop the outreach support in the community to take account of ongoing COVID restrictions. Carer stress has been significant, as we've heard, because of the pandemic, and we want to ensure that the services obviously are underpinned by a key principle for supporting carers. And we've also want to embed the preventative nature of the support of the day centres. So it's really important that they continue to address social isolation and loneliness, because we know that they're significant risks for wider public health. We want to ensure innovation in dementia care and support. And the final principle is about governance. We really want to move, picking up on one of the questions earlier, to genuine engagement and partnership with our third sector, with the providers and with carers and communities, so that we can steer together the future shape and direction of community-based and centre-based support for older people. So that sets out the principles. The strategy again aligns with the strategy that Gillian set out in terms of the two-phased approach. So the first phase is looking at resource review. As Gillian mentioned, some transport, so there's potential there to look at investing in a different way so that we can then invest in the outreach support for older people. And we also need to look at the building spaces. So most of the centres, some of the centres are purpose-built, some of them aren't. So this is just an initial scoping exercise to identify for the future, for the partnership, about where we might be looking to invest in new developments over a kind of 5 to 10 year period. And then the second phase is around the community model. So we've done a lot of work on service design, working with the centres, working with carers and other organisations, looking at this blended model. We need to finalise that so that it reflects the local communities, as I've said. And once we've done that, we'll then be in a position to finalise the commissioning plan. So we're not at that stage yet. We have to finish the design of kind of what we want, and then we work out how we're going to commission it. But we have had early conversations with the centres about it, and the partnership's committed to developing a light touch commissioning approach, ensuring a focus on quality. And we also want to improve the longevity of funding for the centres, because they have been traditionally on a year-on-year basis, and we know that doesn't provide stability, it doesn't encourage innovation, so we want to address that. But obviously we're also aware this is a significant investment in public money, so the partnership has to exercise due diligence in how that funding is allocated. So we'll be bringing forward proposals about that to the September meeting of the IJB. And then the final part of the community model is the development of meeting the gap in service in Musselburgh. So we don't have a centre there, and what our proposal is that we develop a slightly different model, which is called a dementia meeting centre, which we spoke about at the development session. And the key difference of that is it's an evidence-based model that delivers high quality outcomes for people with dementia and their carers. And it also has an established process that's been set out as a result of a number of evaluations about how you set up a meeting centre. So what we're looking for IJB to do today is to approve that we follow that process through, and that in September we come back with specific proposals about how to implement a meeting centre. And I guess the other 2 points on the meeting centre are it's not dependent on a new building base. So part of the process is exploring existing community assets that could be utilised. And the other part of the model is that it supports the development of satellites. So we would want a centre in Musselburgh, but we would also want that expertise and innovation to be rolled out across East Lothian, and the satellite model would allow us to do that. So that's the principles and the strategy. I'll pass back to the chair. Obviously, happy to take any questions.
Thanks very much, Christine. Fiona O'Donnell.
Thank you so much for that update. I wanted to ask, I mean, it's good to see now the kind of the continuous journey of care for people and the recognition of the preventative work. And I just wondered, if we probably don't want anything added to the work stream, Christine, but looking at earlier interventions as well on that journey. I'm aware of a project in Preston Pans, my ward, where the Benefit Development Trust has a befriending service, which is keeping people active, engaged, and preventing isolation so that they don't require the next stage. So I just wondered if there were any opportunities, and I noted the report today on grant funding to recognise that in our directions and in the work stream. Thank you.
Thanks, Fiona. Do you want to take that first before Tricia comes in, Christine?
Yes, absolutely. I think that's a really valid point. So we need to look at, as you say, the journey through and the kind of almost like a stepped care approach, and change the way of looking at it from intervening, as we've talked about in many of the meetings that you've attended with the centres at a critical stage, and moving that back earlier in the process, because that's where we get the greater benefit in terms of prevention. And one of the key things about the outreach model will be it's about not just about new members in the community, but how centres engage with other partners and providers and provide that service and avoid duplication, but provide that sort of enhanced level of community support and development.
Thanks, Fiona. Tricia?
Thanks, Christine. A really thorough report, and I really commend you for the flexibility, particularly following the pandemic challenges, but also with the demographics that are presented within East Lothian. So my question really is, you will have thought of how to evaluate the impact of the different models, and sort of learning from what other people are doing elsewhere has influenced probably the design currently, but also just to keep a light touch on looking at how things work and what is best practice, and the feedback not only from the clients but also the staff.
Yes, thanks for that question. Yeah, absolutely. We need to build that in as we go forward into the way that it links back to the governance arrangement. So rather than seeing governance purely as a kind of quality assurance process, that is about the sort of stewardship and learning from providers and sharing that good practice. Throughout all the work we've done in both the under 65s and the over 65s, we've done a lot of work with Healthcare Improvement Scotland and other colleagues who've shared sort of evidence-based models of community-led support, and that's what's informed the development of our proposed models for under 65 and over 65. But we want to be in a position where we can contribute to the kind of learning in the sector as well, and share that so that we can develop things going forward.
Christine, can I ask you a question about community assets? I suppose it applies equally to Gillian's paper, but are you considering the broader community asset or only assets that we control at present?
We've got quite an open approach to that. So we've recently commissioned an additional piece of engagement work from a social enterprise, and they're going to be looking at community asset mapping, because we need to be thinking about what social enterprises can contribute to the sort of wider community support agenda. So yes, we'll look at all the council assets and other community assets as well, and I encourage that kind of solution focused discussions about how things can be shared. So we've got lots of good examples of how social enterprises have approached us in terms of what they can offer, so we hope to be able to make the best use of those in our plans going forward.
Do you find that the council, if I use them as an example of the two partners, the council are able to demonstrate where assets may become available and therefore at your disposal should that arrangement suit both parties?
They certainly, yes, obviously they've got a process where they develop and identify the assets that would be available for a transfer, but that would necessitate a sort of another vehicle to kind of manage that. So it's about how would a partnership, not the health and social care partnership, but another kind of public social partnership deliver that. And that's one possibility for the meeting centre, that actually it could actually be delivered through a social enterprise arrangement. But the council have been supportive in looking at assets and looking at developments. And as we go forward, I think we need to get in earlier discussions about capital development plans so we can contribute the requirements for older people and community-based support and spaces that we so badly need consistently going forward.
Thanks, Christine. I think I can see Paul, you've got your hand up.
Yeah, thank you, Chair. I understand the process of consultation and engagement that's taking place today, and that's great that has happened. But my question is more about how we make sure that our citizens are informed of these changes and understand them. And I guess it applies to people who are under 65 as well as folk who are over 65 and their families.
Paul. Can I offer that up to Gillian and Christine, because I know we've moved on from your paper, Gillian, but potentially the question applies to both.
I can go first, Gillian, if you like. Okay. So as I mentioned, we've commissioned a piece of work from a social enterprise, which is really about having those community conversations about how communities ready, what support can be provided locally, but also in terms of thinking about how communities can be engaged in the process going forward, so that we will be looking to engage at all the different kind of fora that take place, such as the health and wellbeing groups that are in operation, but we also really trying to move beyond what we call the usual suspects and try and engage more broadly with people who don't in communities often have their voice heard, and so that's why we've brought this organisation in. So hopefully that process is much more explicit and transparent, and we can find out, we can hear from communities what it is and how they want to be updated and kept involved in this sort of programme as we move forward.
Thank you.
Do you want to add anything, Gillian, or will I?
I think Christine summarised it very well.
All right, thank you. Richard, you found your hand.
I have indeed, Chair. Thank you very much. It may have been mentioned in the previous paper, but I think it applies to this one as well. And it was the thought of trying to give funding for more than just the 1 year to the facilities to help them plan better. And that certainly would be welcome and would help them recruit staff and know what their income would be for the forthcoming 2 or 3 years. But that would be a challenge because our own funding, of course, is agreed only on an annual basis. So might there be a risk that we set ourselves up to have an increasing unbalanced budget?
Claire, would that be one for you, or Alison? Are you happy to invite Claire to answer that?
Yep, I'm happy for Claire to come in on that one.
Sorry, could you just repeat that, Richard? Sorry.
Yes, it was briefly, it was the fact that I think we were proposing that we fund the facilities not on an annual basis, but give them a 2 or 3 year funding guarantee. But the risk would surely be that our own budget being set annually, we could end up with a discrepancy between our own budget and what we've guaranteed to the facilities.
Yes, and that's similar to when we had our discussion regarding the living wage uplift, where the monies came in on a non-recurring basis, yet we're making commitments over a longer period of time. So that would be something that we would take account of when we develop the IJB's financial plan and look at how we could potentially manage that financial risk in the anticipation of our budget offers coming through from partners every year.
I think it's going to remain a risk, Richard, and the risk of not doing it to me is outweighed by the risk of doing it, because we offer some certainty to the people that have been rightfully crying out for more certainty for years and years. Richard, are you happy with that response, or do you want to come back?
No, I accept it's a risk that needs to be mitigated. I suppose it is the risk that we then commit funds and other things emerge that we then can't fund, but that is life, I suppose, isn't it?
Yeah. Shameen, is your hand up? Yeah.
Thank you. I think the kind of the 4 year funding, I recognise what people are saying, but I think that'd be very welcome by them to enable them to plan and develop local services and have them really embedded, whereas it's kind of year on year. So I think that'd be very welcome from them. I think I really want to emphasise your point, Christine, of the importance of it being a light touch approach for the day centres, and how that approach will recognise kind of community contribution, local employment, volunteering contributions. So, for example, all the day centres are trained up in supporting people with dementia, for example. All of them have done that, and I just want to kind of be reassured that those kind of things that they are doing, how they'll be that'll be recognised in there. And I really support the dementia friendly centre for Musselburgh and the satellite approaches. And I think the day centres would welcome that approach as well, especially looking at the issue of dementia within the county and moving forward in our demographics. And I think that'd be really, really welcome. I think that's a really vital, important part of this paper.
Thanks, Shireen. I think it's maybe a comment more than a question. Shireen, is it? Do you want a response to that?
I don't know if Christine wants to say anything about kind of their recognising that and within this process.
No, absolutely, and I think that's exactly what we'd be looking at as wider community benefits, and that's what quality is about, isn't it? What people's knowledge and skills, how they share it, how they develop that, and how they can make use of that in developing services going forward. So absolutely, these kind of initiatives and the skills and knowledge that people have are absolutely fundamental to that. So we would really welcome the chance to reflect that in the work going forward.
Thank you. Just one other point I just wanted to raise. When we met with them the other day, one thing they did highlight is that as they're emerging out of COVID, and Christine's been supporting them all to be able to be open partially, is that they were picking up more mobility issues with people across the county, and just to note that and to see how we support that.
Yes, that's something we've discussed, and we're looking at a pilot around managers of day centres having access earlier, direct access to community physio, and we're in the process of developing that with colleagues, but it is absolutely key at this stage, absolutely.
Okay, Shireen.
Yeah, thank you.
Fiona, you want to come back in?
Yes, thank you, Peter. Christine, it's probably too far ahead to be able to say, but I wanted to ask, in terms of the Feely report and the extension of free personal care to all care services, because it's not just about our funding, that D-Centre members make a contribution themselves, I think about average of £10 a day. So do we know if the scope of the review intends to cover that, so that people we commission to provide a service would then not be able to charge for the service?
Well, we've had these discussions with day centres already, so I guess we're needing to see what the actual proposals from the Scottish Government are, and then the partnership would make a response. But clearly, yes, the centres will, if there's free social care and no charging is approved, then there will be a gap in their finances, absolutely. So that needs to be considered, I would be assuming, at Scottish Government level with that policy shift, but I'm not sort of privy to any other further discussions on that.
Yeah, I think it's an important point to note, Fiona, but we're a bit in the dark still with quite a lot of the detail of what's to come. I'm not seeing, unless anybody wants to shout out any more requests to question or comment. No. So on that basis, can I hand back to you, Fiona, for the roll call, please?
Thank you, Chair. Just to confirm that the recommendation is to agree the principles as set out in 3.3 and to agree the strategy set out in 3.4, and to note that proposals will be brought to the IJB in September. And if voting members could indicate how they wish to vote. Shameen Akhtar.
Support.
Neil Gilbert.
Support.
Sue Kempson.
Support.
Fiona O'Donnell.
Support.
Patricia Donald.
Support.
Peter Murray.
Support.
Richard Williams.
Support.
Thank you. That's the recommendations approved unanimously, Chair.
Thank you. Can I just thank Christine and Gillian for not only today, but for all the work that they've done in this with our teams, because there's an awful lot of effort went into this. As is evident from the paper and the appendix, and clearly the engagement, which is often unseen, but the hard work that goes on, speaking to people about changes that are often difficult to absorb and accept. But I get the impression certainly that these are changes that will be ultimately to the benefit of the recipients. So I look forward to the conclusion of that as it moves on. So thank you to you both.
Yes, thank you.
Thank you.
Okay, we shall move on, Fiona, to item 6, please.
Item 6 is the East Lothian IJB strategic plan. And I think it's Paul to present.
It is, yes. Thank you very much, Chair. The short paper in front of you reflects on the fact that we are at the stage in the current IJB strategic plan where ordinarily we'd be looking to review that plan and begin to draft a new plan for a further 3-year period. But we're in a position where, because of a number of factors, including the impacts of and ongoing impacts of COVID and the still uncertainties around the full implications of the review of adult social care, and indeed the work that's about to start on the review of integration schemes, there is justification perhaps to delay the renewal of the strategy. But I'll come to those recommendations shortly. The paper gives a bit of background to the purpose of the IJBs and the strategic plan itself, the way in which the plan is the way that we in the IJB are able to plan and deliver all the functions that are delegated to the IJB, including the use of directions to assist our partners to deliver the strategic and operational priorities. So the plan is a very important document which is developed in consultation with our partners and with the general public and other groups, and has input, of course, from the IJB itself. And it's been a very thorough process previously. We're in the period of this being our second strategic plan, and I think the plan itself has grown and developed over the time since we initiated our first plan. There's a bit of debate nationally around whether the plan should continue in the 3-year cycles uninterrupted, and that has resulted in different decisions being reached. There are some areas that have taken the plan and just done it again, taking into account all the uncertainties that are around at the moment, and there are other areas which have decided to renew the plan after a period of pause and reconsideration, waiting for some of the uncertainties to clear. So we ourselves, I guess, are faced with that opportunity to either press on or to consider the options for a short or longer term delay. The assessment part of the paper talks a bit more about some of the implications on services of COVID, including the stepping down of services for a period of time while we responded to the early stage parts of the pandemic, and the processes by which we've been stepping up services again, both in terms of the things we've been doing locally within our own directly planned and managed services, but also in those services that our patients and clients receive from within the NHS Lothian managed suite of services. It does take a lot of time to, as you can imagine, plan for stepping down and stepping back up and ensuring that we can maintain systems that are of high quality and we can deliver good outcomes for our patients and clients, and that does limit management and other colleague availability for strategic plan development. You all know about the independent review of adult social care, hugely ambitious document with 53 recommendations that will have a big impact on the things that we will be responsible for locally and deliver through directly managed services, or indeed those things that might come in to be new responsibilities and duties. There are, of course, elements of change that come from the adult social care plan, which arrived last November, which has some relationship to the IRASC document. So we are expecting to see guidance and policy soon, and it may be that that will have an approach that looks at the adult social care plan and the review of adult social care together. The assessment section closes by reflecting that if we do produce the plan as we would do normally in line with the usual timetable, we might not be able to fully reflect the requirements of the adult social care review and the adult social care plan, or indeed the implications of the integration scheme, that review of integration schemes that's underway currently in Lothian. So the suggestion of a delay was taken to the SPG at the beginning of June, and they were in agreement with option number 2, that the plan should be delayed for 6 months to allow some clarity to become evident, so that we could develop a plan that was more likely to cover all of the various areas of responsibility and duties, either new or confirmed as continuing. So the recommendations that I'm asking you to consider today are 1, to continue and produce the plan as we do normally, with a view to it being in place again from March 2022 and to run for a 3-year period until 2025. To delay the plan by 6 months. This is the option that was favoured by the SPG. That would mean that we'd have a new plan effective from September 2022 running until March 2025, in effect a plan that would run for 2.5 years, or that we delay the strategic plan for 1 year, which would give us a plan of 3 years duration, but it would run until April 2026. I'm happy to take any questions on the paper. Well, before I close, I should say, those of you who need reminded of the recommendations of the Adult Social Care Review, those are appended at Appendix 1.
Thank you, Paul. Obviously, as you'll see within the recommendations, there is a favoured option by the SPG, which is recommendation number 2. Does anybody wish to ask any questions of Paul on what he said? Paul, in the absence of any questions, can I make one comment, please, just for noting that whilst I'm personally, as I will indicate in a moment, in favour of option 2, that would be with the caveat that we felt as an IJB we had sufficient resource to deliver that in a way that we would want as an end product, because the demand to create such a plan in the relative uncertainty will not be known until nearer that time, but resource will be a key component of making sure that we don't have to rob Peter to pay Paul.
Mm-hmm.
So on the basis of what I am sensing, Fiona, is it acceptable just to go to recommendation 2, which is the preferred option, rather than do a roll call on all 3?
Yes, I think that seems reasonable, Chair, and if the recommendation is approved, then I think we could consider that recommendations 1 and 2 would automatically fall.
1 and 3.
1 and 3 rather.
Yeah.
2 would be.
Is everybody happy with that approach? If you're not, then please speak now. Okay, so on that basis, can I hand back to you, Fiona, please?
Okay, thank you. I will go through the roll call now, and if members could indicate which way they would like to vote on recommendation 2. Shameen Akhtar.
Support.
Neil Gilbert.
Support.
Sue Kempson.
Support.
Fiona O'Donnell.
Support.
Patricia Donald.
Support.
Peter Murray.
Support.
Richard Williams.
Support.
On that basis, Chair, recommendation is 2 is unanimously approved and the other 2 fall.
Thank you all for that. That was very helpful. We'll now move on to item 7, please, Fiona.
Item 7 is the review of integration schemes, another SBAR update, and I think it's also Paul for this one.
It is, yes. Thank you, Chair. I mentioned this in the previous paper. There is a process underway led by NHS Lothian to review the 4 integration schemes across the Lothians in East Lothian, Mid Lothian, and West Lothian, and in the City of Edinburgh. And this is a requirement that the scheme has to be reviewed every 5 years. And since our scheme was initiated in 2015, we are a wee bit overdue. We've delayed and overdue in reviewing the scheme. That was, of course, part of the relaxations that surrounded the COVID-19 pandemic. Anyway, the board have now found assets and an individual, Peter McLaughlin, who's leading on that process, and he came to the SPG at his last meeting to broadly present this paper, making the case for taking the review forward and setting out in the appendix in a couple of documents, a paper and a presentation, the process that's going to be carried out. There has been a revision, as you'll probably recollect, to the schemes because of the changes to the Care of Scotland Act, but there was always the intention that the scheme itself had to be revisited and properly looked at in terms of the issues that perhaps needed to be reviewed. And the earlier discussion in the meeting about conversations between chairs around delegated powers and responsibilities, I think is very pertinent to this process. The background tells you a little bit more about the legalities of the schemes when they were initiated and the review process, and the fact that in May the Scottish Government decided that there should be progress on reviewing the schemes. There's, as I say, a formal review process which has involved the chair of the Health Board writing to each of the chief executives of the local authorities to seek officer and senior officer and legal input to the process, and we're just waiting for confirmation of who that will be locally within East Lothian and for the other 3 areas. The recommendations that the IJB is being asked to note regard the process that's underway, both the need for the process, the plans for the project management arrangements, including involvement with local authority colleagues, the local authority officers, and the involvement of IJB voting members. We are expecting the notification of that shortly. We haven't yet heard the formal membership, but there is a proposed membership in the attached papers. And the recommendations also ask the IJB to note that Health and Social Care Partnership Officer support will be expected and provided to that process. So it's something that's being led by the Health Board, but it's very much in partnership with the Council and with the full input of the necessary officer support to the process. So I'm happy to take any questions on the papers or the appendices.
Any questions for Paul? No, you're getting a very likely, Paul. My only observation would be that in light of this work, it would make the delay to the strategic plan probably even more relevant. So it makes sense that the two kind of coincide with each other. Fiona, I'm noting that there's no roll call required to this because there's only the recommendations are only for noting.
That's correct. Yes, it's just a general agreement from members to note.
So I take it we're agreeing to note.
Agreed.
Agreed.
Thank you.
Peter, may I just say that, well, I'll be sure to bring back updates to the process to the IJB, either through briefing papers or more formal papers, as and when these are available.
Yeah, that would be really helpful, Paul. Thank you for that. Can we move on to item 8, Fiona, please?
Yes, thanks, Chair. It's the establishment of a community hospitals and care homes provision change board.
Is this you, Alison?
I think Bruce is here to
Okay.
present this.
Good afternoon. Thanks, Chair. Thanks, Alison. This was to provide an update to the IJB on the establishment of the Community Hospitals and Care Homes Provision Change Board. So just to really set out what we've set up and established. So some of you will be aware, and some of you indeed were involved in the work previously from the IJB direction, originally 12D, around the reprovision of Belhaven and Eddington, and S Green and Abbey care homes. A paper was presented to the IJB on the 13th of December 2018 with some proposals. This board now has been established to move them forward. There's obviously a slight delay in terms of some work that was taking place through 2019, the gathering of information, some work around data on beds and throughput and turnover, and then obviously in 2020 with the impact of COVID-19. So we want to reconsider and reset this work really, and take into account those circumstances. This IJB strategic plan Paul has just highlighted, COVID-19, the challenges that there are likely to be around capital funding and what that might mean for an impact in terms of bids, and indeed separately we need to look in East Lothian at those capital projects that we may have and how we may prioritise them, and there's some work ongoing, and that will be discussed initially at the General Manager meeting, hopefully in the next few weeks, to look at that. So that's going to impact in terms of the capital prioritisation. We also need to take into account any changes that have taken place in the housing strategy, and also the independent review of adult social care and other documents or policy guidance that we're aware of. So we want to present at some point back to the IJB, probably the early part of next year, around some outputs and recommendations for the IJB. We've had our first Change Board meeting on the 31st of May. We have our second one on the 15th of July, and they will meet every 6 weeks. As part of that, we've established 3 work streams, work groups. One around finance and capital, in part to take an account of linking into some of the capital issues that we might have through NHS loan, etc. in the council. We have a capacity and planning group that will look at the hospital capacity beds, care home capacity, and some of the intermediate care services that we already have, and what else there could be as part of that development. And then thirdly, our communication and engagement group. We've got these chaired by senior managers within the IJB, within the partnership rather. And in terms of the communication engagement group, we're working on developing a communication engagement strategy. We're reviewing the stakeholder matrix that we put together for the last work, and that has been reviewed, and we will be making some contact with all the groups that we are able to across East Lothian in the coming weeks and months. We've also taken some work initially under the integrated impact assessment, and what we're thinking there is that rather than necessarily wait till the end of the project or until we've got a model, we might do not quite a before, a during and after assessment, but almost that description. So we're looking to pull together a quick integrated assessment in the next month or 2. That will help form us to make sure we're contacting the right groups, involving the right individuals and organisations, and also help us with the development of the model as well going forward. So in terms of the noting for recommendation, it's to note the establishment of the board, and we have Peter Murray as chair and Alison MacDonald as vice chair. We've got the formation of the Change Board, which was approved at the IJB Strategic Planning Group on the 5th of May. We have the terms of reference, which is attached to this document, and that you will request regular updates and progress on our project plans and our development. And I'm happy to take any questions from anybody. Thank you.
Any questions? Patricia, and then Fiona. Sorry, it was Fiona first, but Patricia, you go.
You're happy for me to go? I mean, Bruce, it just sounds so sensible to have a change board on this topic. And my question is, how does this link into Alex's Lothian Health Board support for the care homes work? And will that be sort of coordinating across all the IJBs, or is this very independent? How is just the linking of all these different groups on the care homes?
Alex McMahon, Bruce, do you know him?
I'm not quite sure what that group's called. That's why I can't remember the name of it. But
Oversight group.
Oversight.
Did I maybe come in that, Peter?
Yeah, of course.
Yeah, sorry, I'm on that oversight group, Tricia, as is Lorraine Cowan, our chief nurse. They're actually different asks of what we're asking this change board to do. This is about the physical environment and the care homes that East Lothian Council have at the present, Belhaven Hospital, Eddington Hospital. So the future use of our older people units across the county. We will continue to fit in with the overarching the strategic group for care homes around IPCT, etc. What we will do is, as part of this work, though, we will use some of the infection prevention and control work, and you will hear us talk about that as a benchmark for if the current environment meets the right expectations for IPCT, or if we come to you with future suggestions or ideas, we will be saying that it definitely does meet the criteria for good infection prevention and control and management of infection at cohorts and rooms and sizes and all of that. So we will link very closely with infection prevention and control to make sure anything we bring to the IJB as a proposal will meet the criteria that are set out for the group. So very close links.
Thank you.
And I think just to thank Patricia, just add to that as well that we will take account of any developing care and inspectorate guidance or standards that comes out as a result of the impact on COVID, and also from the original documentation, the original report back in December 2018, we had identified design of some facilities and infection prevention control as issues that need to be resolved as part of that work at the time. Thank you.
So good question, Patricia. Thank you for that. I think I've got Fiona and then Richard, please.
Thank you, and good to see you, Bruce. And I remember well all the engagement work that we undertook, and Peter, you were very much part of that as well. The first one is at a kind of pedantic point. Can we call it the East Lothian Community Hospitals, plural? Because I think it might cause a bit of confusion that people think it's just about the hospital in Haddington. And the second point was or the question was around engagement, that I'm very aware, representing and Neil Gilbert as well, Preston Seaton Gosford, that we're unique in not having either a care home or a community hospital in the ward. So to ensure that there is representation from Preston Seaton Gosford, whether that's through the health and wellbeing group associated with the area partnership, but people living in my ward will also need to access these services. And I think it's really important they're part of it. Thank you.
Thanks, Fiona. Just one, Bruce.
Please, thank you. Thank you, Fiona. And yes, lovely to see you again as well. It's probably about 3 years ago since we stood at the Brunton Theatre. And I could have sworn it was only about 12 months ago. So time does fly. Yes, I agree in terms of it should have had both S's, and that was something we described and discussed. So it doesn't cause that confusion. Also, yes, around the health and wellbeing groups and making sure, that's why we especially want to review the stakeholder matrix to ensure that we're getting across an East Lothian perspective in terms of lots of different communities and the impact that and access to services for different communities. So yes, we will be making sure that we involve as wide a range of individuals and groups as possible.
Is that okay, Fiona?
Yeah, I wonder if I could ask a further question as well. I'm just aware that this is an issue that is very live in the county and at times becomes quite politicised. And the membership just now has from 2 of the political parties in the council, but I wonder if we should extend the membership so that it's cross-party, and if Neil Gilbert was to join it as well, then that just makes sure that everyone is round the table and no one's being excluded. So I don't know, Neil, how you feel about that.
Yes, I would gladly join it and equalise the political membership across the board.
I think that's a good suggestion. Bruce, are you okay with that, Alison?
Yeah, I'm fine with that. It's a good idea. Yeah.
Yeah,
okay. We'll
action that.
Add you in. Are you okay now, Fiona? Yeah, thanks. Richard.
Thank you, Chair. My question is also about membership. I just see that under the role of general practitioner, you have my name, and whilst once a GP, always a GP, I have been retired for over 2 years. So I wonder if you don't have to make the decision just now, but whether if you want a general practitioner, you should have a practicing general practitioner, or whether you actually want me, you should change my title to IJB member. But I think, yeah, I think personally speaking, perhaps you want an active GP. That might be sensible. But so you don't have to make a definitive decision just now, but just to raise that as an issue.
Yeah.
Okay. Yes.
Can we take it off the table?
Yeah.
Take it off table, Bruce, and give it some thought.
Yeah, though we can, again, we can action that one as well.
Thank you, Richard, for raising that. Any other questions? Janine?
Yeah, it was just it's a helpful paper around the communication and engagement group. I don't have the answer to it, but just because of the current environment we're in, I would just encourage to be as inclusive as possible. And I know we're doing quite a lot of things through virtually, but I don't know what other methods and ways that you might be able to use to get out and about as much as possible to have that level of engagement, and ways that different communications within the organisations can support you in that. In going forward, and I think that would be quite key of getting that information out so people are aware and they're able to fully engage.
Yeah, I would support that. I think I heard last week or read last week that there was a community council suggested that they hadn't heard of the IJB, which I find quite astounding 5 years down the line. But nonetheless, that was what was suggested in some minute I had read. So we've all got a job, I think, to help communicate, particularly on this issue, because
Yes.
it's going to become a very important issue, and we want the messaging to be factually correct and not conjecture and speculation. We want it to be based on the actual evidence that is going to be collated and developed to get this proposal to an end point. So all your help would be very gratefully received on the point that Shamine's just made.
Yeah, it would just add to that we have had those exact thoughts. It's almost we're just on that cusp of being able to do something live, and it's always it's great on Teams, and it's certainly good in terms of trying to maybe some of the more remote parts and access. It would be really good if we could do some real live events, and that's when you get some real feedback and thoughts and views, which is really rather helpful. So we'll probably have to keep an eye on the guidance. We'll have to keep an eye on practicalities. If we can do some live ones, then we certainly will do. It would be really helpful. I think part of it is we've identified the work stream, comms and engagement, as we're aware that there'd almost been a little gap in knowledge as to what was happening. So we felt we wanted to highlight the importance of that. That's why we've got a work stream to just keep a heavy focus on that. The other thing just to add is I'll pull together very briefly a councillor's briefing as well, just to circulate in terms of a summary of just to some extent what I've said in the S-bar attached and any further updates, and I'm happy to do that. And as I did last time round, I'm happy to meet with councillors and MSPs on a one-to-one basis for 10-15 minutes if that's of use to anybody, but I'll offer that up. I'll do that through everybody's PAs. If they don't want to, that's absolutely fine, but also if they want to, that was a really useful way of gathering some information at that time that we're able to then feed in, and it helped to develop some of the themes for feedback and input, etc. But we're obviously always happy to take any suggestions or ideas as well. Thank you, and apologies as well if my throat's going. It's that time of the year. Thank you.
Fiona, can I just check that the change to membership doesn't need anything other than just noting?
I don't think so, because the membership is actually agreed by the change board itself, so it's not the IJB that agrees it. So no, it's fine to know. Yeah.
Okay, so there is no roll call required for this update. So thank you for that, Bruce, and thanks to all for the questions. Happy to move on now, Fiona, to item 9.
Yes, if members could just quickly give their general agreement to note for item 8, that'd be great.
Agreed.
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 Item 9 is the 2020-21 draft unaudited annual accounts, and it's Claire Flanagan to present.
Thank you. So these are the draft unaudited annual accounts for the IJB for financial year 2021. The accounts were presented to the IJB's Audit and Risk Committee on the 8th of June 2021, where they were considered and approved for recommending to the IJB for agreement, publication and audit. I think it's worth, before I take you through the document, I think it's worth just highlighting that the accounts this year did prove to be more challenging in light of the additional COVID costs, the additional COVID funding streams, and also the accounting treatment for these funding streams within both our partners organisations. So I will talk you through the main points within the document. So the accounts start with the management commentary. This focuses on telling the story of the IJB during 2021. It lays out the role and remit, presents the members of the IJB board as at March 21 and their attendance during the year. It refers to if there's been any change in personnel on the board, and then the management commentary provides a summary of the operations of the IJB during the year. It starts with COVID, and it further references the COVID pandemic and the impact that this has had. In terms of going into the management commentary, it does highlight the financial impact of COVID and also gives examples of some of the interventions that have been put in place by the Health and Social Care Partnership. So, for example, areas we reference will be the sustainability payments we have been making to our external providers, the opening of additional beds to increase capacity within East Lothian Community Hospital, and also more recently the work that's been taking place with the vaccination programme. We then go on to highlight, despite the Health and Social Care Partnership being at the forefront in terms of responding to the pandemic, Alison and our team have actually continued to develop core services for East Lothian residents. So, for example, we make reference to our physiotherapy services, the work we've done in terms of community link workers, and the opening of our CTAX base at East Lothian Community Hospital. Then the management commentary takes you to our plans for next year, where we reference the independent review of adult social care and obviously the IJB's strategic plan. We then summarise the year-end position, which resulted in the IJB having a surplus or an underspend at the end of the financial year. So this underspend that we've reported in the management commentary is £7.2 million. A large value, but I just would like to be absolutely clear, this was made up of two components. It was made up of a core operational underspend of £1.289 million and an underspend of £5.9 million against any funding streams that we have received during the financial year, but we haven't spent in full. And the largest part of our of the underspend against earmarked funding streams is in relation to our COVID funding. So the COVID funding we received from Scottish Government came through. It came through in tranches throughout the year, but there was a large amount of funding that came through January, February time. Now, as an IJB, we did not spend it all in financial year 2021. But what it does give the IJB is the fact that we have the ability to carry this COVID funding forward, gives the IJB some assurance that where we will continue to incur additional expenditure in relation to COVID, we have the funding sitting within the IJB reserved ring fence to support these extra costs. We then provide the financial year-end position by service area and provide an overview in terms of the financial position by direct and pan-Lothian services. Due to the end of the year with a surplus, the IJB has increased its reserves in 2021, and a summary of the reserve is shared. So our reserves balance in total is now sitting at £9.6 million across both general reserves, so contingency reserves, and our earmarked reserves. 3 million of general reserves and 6.5 million of earmarked. But again, the 6.5 million is predominantly driven by our COVID funding that we've received from Scottish Government. We explain the IJB strategy, its business model, and then we finish the management commentary with the risks and uncertainties. And again, we make reference to the uncertainty and change that the COVID pandemic has had and will continue to have. The document then moves on to statements of responsibility. So a statement from the chair of the IJB and myself as Chief Finance Officer. It's followed by the section of the remuneration report, which follows the same principles which we've applied in the last few years, whereby IJB doesn't actually directly employ any individuals, so it's only the Chief Officer and the Chief Finance Officer who are shown in the remuneration report, and we split the remuneration between their role on the IJB and their operational roles they have within the partnerships. The annual governance statement, which I'm not going to go through in lots of detail because we did have a good discussion on this statement at the Audit and Risk Committee, but I would just like to point out that this governance statement is developed by the IJB's Chief Internal Auditor, and it shows reasonable assurance with the overall adequacy in terms of our controls, and it does give us some areas and scope for improvement, which we will take forward as an IJB. The accounts then have the independent auditors section, which at the moment is left blank. So once the accounts have been proved here today, they will be published, and they will also be presented to our external auditors, which is Audit Scotland, for their annual audit over accounts, and they will feed back. They will get our annual audit report, and our final version of our accounts, which hopefully will be finalised by September time. The document then moves on to our IJB accounting statements. So from page 101 in your pack, or page 35 of the accounts, we start with our comprehensive income and expenditure statement, highlighting the 7.2 million of a surplus, and I've given you the breakdown in terms of how that compares with operational underspend and our earmarked slippage and earmarked spending or earmarked funding. The movement in reserve statement, which shows the closing reserve balance. And at the bottom of page 102, we've given a bit more detail in terms of what makes up that reserve balance, and you'll see it's highly a significant portion is in the earmarked funding for our COVID for COVID moving forward. And then we go on to the IJB's balance sheet, which is really just that the IJB's financial transactions take place in two financial ledgers. So take place in NHS Lothian's ledger and East Lothian Council's ledger, and our balance sheet is really the debtors balance that sits within both of these financial ledgers. We then move on to we have some notes which supplement the accounts. Worth highlighting, we've got a new note this year on agency transactions, and this is highlights the new complexity in terms of accounting treatment for so that note has been included with regards to the £500 bonus payment to social care staff and to external providers, which was paid via East Lothian Council. And the accounting treatment for those two transactions were treated as an agency arrangement, whereas the payment that was made to the NHS employees was treated in a slightly different way from an accounting point of view, treated as principal, and therefore it's just part of our normal income and expenditure report. I think it's worth highlighting there is one final issue that just came to light on the actual day of the Audit and Risk Committee, and it's regarding PPE and testing distribution. So this has been picked up by Audit Scotland and Scottish Government, and it's regarding all the PPE distribution and testing distribution came from NSS, so National Services Scotland, and they ran the distribution and for the whole of Scotland. Audit Scotland have now recommended that actually instead of all that PPE distributing sitting in NSS's annual accounts, that actually it should form part of the Health Board annual accounts. And if it forms part of the Health Board annual accounts, there is a potential that it may have to be included in the IJB accounts, and similarly it may have to, depending on the accounting treatment, may have to go into council's accounts as well. So LASAC is the kind of the accounting treatment advisory board that supports local authorities, and our accounts are based on the local authority reporting arrangements. So we're really just waiting for LASAC to review the current situation and to give us some national guidance. Our auditors are aware of the situation that's came very, very late in the day, and we're really just waiting to see what the national guidance advises or tells us what to do, and we will make any necessary adjustments. So if the accounts get approved today, they will present it to our external auditors, and I'm happy to take any questions.
You're on mute, Chair.
You're on mute, Peter.
I swore there, so just as well I was on mute. I was saying, thank you, Claire, very comprehensive as always and easy for us lay people to follow, so thank you. Neil.
Thank you, Chair. Just the one hopefully straightforward question. I welcome the news that you mentioned that the COVID funding can be carried forward and used in the next financial year. It's just to check that there is no limit, you know, that it hasn't to be spent the next financial year. It can be carried forward as far as it will go. Is that possible?
So we're not. We're kind of hoping that we'll probably spend all our COVID funding pretty quickly, and potentially we'll be requesting more during the year rather than having the ability to carry it forward for a further year. But yes, so we've put in we submit we do routine reporting into Scottish Government regarding our COVID cost projections for the year, and Scottish Government have asked we utilise our COVID funding that we have in reserves in the first instance, and then just enter into a dialogue with them in terms of if there is further support required in terms of financial allocations required. In terms of carrying it forward to, if we did have a balance left and carrying it forward into next year, I think we probably need to wait closer to the end of the year in terms of what that will look like, just given the cost projections and the interventions that we put in place can be pretty volatile, so they change quite quickly. So for example, sustainability payments were due to end the end of this month, and I think it's likely they've maybe been extended to the end of March. So our cost projections change every time there's new national guidance that comes out. So we would just keep people updated.
Okay, thank you.
Thanks, Neil. Fiona, then Siobhan.
Thank you, Peter, and thank you, Claire, for the report. And it's lovely to see draft annual accounts which talk about services and outcomes. So really appreciate having that included. I wanted to ask, on page 78 of our papers, and it talks about the cost of the bonus being fully met. Did that include the administrative costs? Because it must have been quite a job of work getting those out the door.
So in terms of, so they were both treated slightly differently. So from an NHS Lothian point of view, it was potentially an easier process, given it was everybody on the payroll. From a council point of view, there was an element of councils had to make a judgment in terms of whose staff were reported through that. We didn't pick up we didn't account for or feedback on any administration costs in processing that payment as an IJB or as a health and social care partnership. I would need to link in with council finance colleagues to see if they have incurred any additional administration costs for processing that as a council, and to see if they fed it back through their own COVID cost projections. So we do it, the partnership across health and social care reports in via NHS Lothian up to Scottish Government, and the council obviously has their own reporting mechanism into Scottish Government. But that's something I could definitely double check with council finance. In terms of yeah, I will do, Fiona. And in terms of the third arm for external providers, it was actually coordinated via Scotland Excel. So we didn't have any administration costs. It was really just processing a transaction in terms of making that payment based on what we were advised to do.
Great, thank you. And I also wanted to ask, as it's in the accounts, and it struck me when we had the roll call at the beginning of the meeting, that we've a number of IJB non-voting members who've not attended and without apology. And I wonder if it'd be possible, I would be surprised if Audit Scotland didn't pick up on that, if we were to follow up with those people to see if there's a barrier to them participating or if they no longer wish to attend.
We could take that away as an action and follow that up.
Yeah, it's a very unusual circumstance, Fiona, what you've described. So I'm hoping it's a one-off and maybe just an administrative issue as opposed to anything else. But we'll certainly inquire because it's an important point. Is that you now, Fiona? Yeah, Siobhan?
Thank you. Thanks, Claire. That's been a really helpful report, and I know you presented it to Audit and Governance as well, and Audit Scotland were present there as well as part of that meeting. I just want to check, the carry forward, just to check that you have full flexibility in how you might be able to use that, because we'll face a lot of challenges as we're moving on to the next financial year and looking at a lot of the services. And I just wondered if you have that full flexibility, or do you need to ask permission to get that? But just so for example, in the area of mental health for adults, if you decided to for example, to go down that route, would you have the opportunity to use those funds in that area if you felt that was the most appropriate way for us to use it to support members of the local community?
So where we categorise any of our reserves or our carry forward as earmarked, they're for specific pieces of work or specific programmes of work, and therefore they come with quite a clear directive or a clear focus on what outcomes we are required to deliver as part of getting the funding stream. So we're, in terms of, for example, our primary care improvement plan, our Action 15 mental health plan, they all come with what we are required to do with that funding, and we routinely report up to Scottish Government on all our earmarked funding streams. So we would just work within that normal guidance that we have. In terms of our general reserve, so that is absolutely within the IJB's gift to utilise. It's non-recurring. It might be worth pointing out, so it doesn't always give us a sustainable financial solution, but it does give us that. What it's there to do is to give us a bit of a buffer in terms of if there's anything we require on a contingency point of view. And I know a 3 million general reserve does feel it's a lot of money, but given the IJB's budget is, it's 165 million pounds. Our reserves policy says our best practice guidance is that we should be retaining a 2% general reserve. So just over the 3 million pounds. So it's good that we've managed to build up this balance over the last 2-3 years, but it's still the IJB's got a large budget, so a 3 million pounds general reserve is still a prudent level. But it's absolutely within our gift as an IJB to do what we would want to do with that.
Thank you very much, Claire. Peter, just on this paper, I would, when we get to that stage, I would like the opportunity to make some comments, if that would be okay.
On this paper?
Yes.
Yeah. Okay. Any final questions? No. Claire, is this your last meeting with us?
It is, yes.
Yeah. Siobhan, if we assemble our mind here, I'll let you go, Siobhan.
Yeah, I just wanted the opportunity just to thank Claire, because I think in the paper we were really conscious of how much pressure everybody was under, and that they were getting on with a really important, valuable day job, and she did everything she could to take the pressure off everybody. So just to thank you for that. But I think it'd be remiss of me not to pick out some things from this report, just as you said, Claire, telling the story of the IJB over the last year. So things like the opening up of the 44 beds at the community hospital didn't just mean that the pressure was relieved off the county, it meant that we're relieving the pressure on the whole region. So that was a really valuable point there at the last Audit and Governance, and I think it just tells you the scale of things. We looked at the East Lothian Community Hospital hub, and I think it's important just to acknowledge that over the last year 1.2 million masks were distributed, 1.025 million aprons, 4.6 million gloves, and 29,800 face visors were distributed across the county, and I think that's a extraordinary amount of PPE that was distributed out by the Health and Social Care Partnership. And where we are at the moment is that 85% of East Lothian's population have received the first dose of the vaccination. 62.3% of people in East Lothian have received their second vaccination. So that work has continued. So they were supporting all our day centres and our care homes, and then it was non-stop, and then continuing with the vaccination programme. And I think that needs to be acknowledged that's been happening. And at the NHS Lothian board yesterday, there was a significant piece of work which covered care home support for care homes. And Fisher was there and Peter was there. And I think just to take the opportunity to thank all the staff for the considerable amount of work that went on to support every single care home in East Lothian, to keep those people, those vulnerable people safe, to keep the staff safe. So I think that's really important to acknowledge that, and just to finally thank Alison and her team for everything that they've been doing over the last year, because I think those reports, it's great to have that narrative, but just have the opportunity to acknowledge that and to thank her and her team. And I'd be really grateful if you were able to pass on that thanks to your team when you go back to with your colleagues, Alison.
I will do. Thank you.
Thanks so much, Siobhan. What I was going to say, Claire, is that you've been a fantastic member of our team. I do hope that we see you again very soon, but as you do depart, it would be very remiss not to acknowledge that you are terrific at the job that you do. You make our lives very easy. You're always very approachable in terms of information that we want or explanations. So we're going to miss you, but I'm sure the next paper will tell us that we're going to be adequately replacing you with a colleague. I don't want to preempt that paper because we've got a decision to make in it, but that looks likely based on the next paper. But for now, on behalf of everybody that's worked with you in the recent past, and obviously Fiona in her capacity as chair, and Siobhan for a short time, thank you for all that you've done for us.
Thank you.
Right.
How dare you?
We need to take a decision on the recommendation in this paper before we move on. So Fiona, can I hand back to you, please?
Thank you, Chair. And if you don't mind, I'll just add my thanks. Claire, you always make my job so much easier. Thank you. Item 9, recommendations, are to agree that draft accounts will be published and presented for audit. So I'll go through voting members, and if you could let me know which way you want to vote. Siobhan Akhtar.
Agreed.
Neil Gilbert.
Agree.
Sue Kempson.
Agreed, with great thanks to Claire.
Fiona O'Donnell.
Agreed, with thanks also.
Patricia Donald.
Agree, well done, Claire, and good luck.
Peter Murray.
Agreed.
Richard William.
Agreed.
Thank you. That's the recommendations agreed unanimously, Chair.
Thank you. Should we move on to item 10, please?
Item 10 is the interim appointment of Chief Finance Officer, and I think it's Alison to present this one.
Yeah, I'm presenting this with some sadness because I can't believe that Claire's getting to go away. I did suggest that she, given the fact we're on Teams, she could have a wee baby basket beside her and just come back. But she wasn't really having that. Thank you, colleagues. This report is self-explanatory. It's to update you on the process to cover Claire's maternity leave and cover the position of Chief Finance Officer and Section 95 Officer for the IJB. And I'm asking the IJB to agree a proposal to recruit interim cover for the maternity leave period, delegate authority to myself and the chair of the IJB to approve the interim appointment on the IJB's behalf after the recruitment process, and note that an update of the outcome of this process will be provided at a future IJB meeting. I think the rest of the paper is quite self-explanatory, but I'm happy to take any questions if there are any.
I think it's quite straightforward. Are there any questions, Patricia?
Just a quick question, how long does the recruitment process take, and will there be a gap?
It's already started.
Oh, well done.
It's already started.
Hope it goes
yeah.
for you.
To be honest, we would like an appointment made before Claire goes off. It's a huge remit. There's a lot going on, and it'd be really good for us if Claire could give a handover to the person. So we're really keen to not have a gap.
Okay. No other questions? Can I hand back to you, Fiona, for the roll call and the recommendations, please?
Thank you, Chair. The recommendations as outlined by Alison are for roll call approval, and I'll go through the members. Siobhan Akhtar.
Agreed, and congratulations, Claire.
Neil Gilbert.
Agree.
Sue Kempson.
Agree.
Fiona O'Donnell.
Agreed, and I can think of no better reason for you to be leaving now, so I'll take that back, Claire.
Patricia Donald.
Agree.
Peter Murray.
Agree.
And Richard Williams.
Agreed, and best wishes.
That's the recommendations approved unanimously, Chair.
Thank you. Can we move on to item 11, please?
Item 11 is the change to membership of the Audit and Risk Committee. And I don't know if Alison wants to cover that or if she wants me to do it.
Sorry, I was just assuming you were. Sorry, Fiona, that's a bit of an assumption.
That's right. The paper, as with item 10, is fairly self-explanatory. It's just inviting the IJB to agree a change of membership to the Audit and Risk Committee, to say goodbye to Fiona O'Donnell, who's coming off the committee, and Shameen Akhtar is to replace her. The membership of the committee is in the gift of the IJB. It's up to you to decide the memberships. I'm happy to take any questions.
Any questions for Fiona, or should we just go to the roll call for the recommendation? I think we'll go to the roll call, please, Fiona. Are you still there, Fiona?
Apologies, I muted myself. I shouldn't do that. Shameen Akhtar.
Agreed.
Thank you. Neil Gilbert.
Agreed.
Sue Kempson.
Agreed.
Fiona O'Donnell.
Agreed, and thank you, Shameen. Enjoy.
Patricia Donald.
Agree.
Peter Murray.
Agree.
Richard Williams.
Agreed.
Thank you. That's the recommendations approved unanimously, Chair.
Thank you. I note that Sue's got to leave in 4 minutes, so we'll try and get item 12 in relatively quickly. So item 12, please, Fiona. Item 12 is 2 reports relevant to the IJB that are being placed on the agenda for members to note. It's 12A is the East Lothian HSCP commissioned Community Support and Grant Awards for 2020-21, and 12B is procurement of carer services. I don't know how you want to take it, Chair, if you want to ask for questions or comments, or if you're just going to ask members to note and take up with officers if they have any questions. I think we should allow questions if members feel they want to ask any. Fiona, you've got your hand up.
Sorry, I seem temporarily to have lost my hands up function. Just say I really welcome in this report that we're looking at increasing the funding, because I think some of the interventions we want to see are best coming from our community. So thank you very much.
I think Richard may have stole your hand, Fiona. Any other questions? No. So if there's no roll call required in this, Fiona?
No, there's simply some notice. It's just general agreement.
Agreed.
Okay, have we covered sufficiently A and B? What we've just done? Fiona?
Yeah, I think so, yes.
Yeah.
Taking them together, but if members have any questions or comments, but if they're happy to agree both as is.
Yeah. Are we happy to agree both? To note both?
Yes,
Yeah.
agreed.
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 Okay, that seems to have taken us to the end of the meeting. Is that correct, Fiona?
Yes, that's all
Yeah.
of the business today.
So, in the very helpful script that Fiona provides us with as chair, it says at the end of the agenda business, please ask all participants to mute their microphones and wait until the recording has been switched off before they leave the meeting. So if you can do that, please, that'd be very helpful, and we'll then stop the recording.